No financial interest to disclose.
India, a nation and subcontinent with diverse heritages. Sushruta, the most celebrated cataract surgeon of 5th century BC, practiced 150 years before Hippocrates, who initiated the movement of eye care in ancient India. During the British era, British surgeons trained a few Indians in the principles of medicine, and the first medical school in British India was established in 1824 in Calcutta. After the British Raj, a significant milestone was the establishment of Ophthalmic Center in All India Institute of Medical Sciences, New Delhi in 1967. And now, every state in India and every district has medical schools and ophthalmology training institutes. The future of Indian ophthalmology looks very bright. Presenting the great Indian history, Chronicle of NPCB. National Program for Control of Blindness, abbreviated as NPCB, is a 100% centrally sponsored program. India was the first country in the globe to launch a national program of this kind, as 80 to 90% of vision loss was avoidable, simply meaning preventable or curable. This program originated with a national goal to reduce the burden of blindness from 1.4% to 0.3% by 2020 by gradual developments. Objectives were to identify and treat blinds, develop eye care in every district, and a joint venture of public-private partnership programs. The program was well organized with state societies and district organizations to work on field level to providing primary, secondary and tertiary levels of eye care. The well-established referral systems from primary to secondary and tertiary centers. In collaboration with World Health Organization, standard definitions of blindness and visual impairments were established, and NPCB was transformed into National Program for Control of Blindness and Visual Impairment. The World Health Organization, the World Bank and the Danish International Development Agency joined hands at different time periods to assist overcoming India's blindness along with NPCB. One of the major ventures of NPCB was to overcome cataract blinds, as cataract was the single most contributory factor in 80s and 90s, responsible for between 50 to 90% of all cases of blindness, in addition to other objectives of NPCB. With just 6,000 qualified eye doctors in India in the late 80s and in 90s, and with many non-operating physicians and lacking sufficient beds and operation theatres, schools and other public buildings served as temporary eye hospitals and temporary operation theatres in the surgical camp era. Initially, the program had hiccups wherein majority of people who were advised for cataract surgery denied and didn't come forward. Perhaps it's amazing to note that 200 to 300 cataract surgeries were performed per camp, and patients were treated as inpatients for a week alongside free food and free aphakic spectacles. It's interesting to note that near 50% of surgical camp supports were rendered by voluntary agencies between 1976 and 1992. Intracapsular cataract extraction with aphakic spectacles were the procedures of choice, and as expected, many of the services were available in the urban areas, whereas most blind lived in the rural areas. After the national survey between 1998 and 2000, the strategies of National Program for Control of Blindness were revised, and the services of NPCB extended beyond cataract into overcoming uncorrected refractive errors among children, overcoming corneal blindness. Other causes of blindness such as glaucoma and retinopathies were taken into consideration, and there happened a paradigm shift of focus to a fixed facility rather than surgical campsites, and transformation of cataract surgery into cataract surgery with intraocular lens implantation procedures. Whereas the strategies of rural outreach screening activities are still continuing, and the patients are taken to the base hospital for surgical interventions, successfully performing 66 lakh cataract surgeries annually. 9 lakh free spectacles annually were dispensed to children in school screening campaigns, and successfully collecting 50,000 eyes a year for corneal transplantation procedures. along with the participation of the society and voluntary organizations. All the cataract screening outreach campaigns transformed into comprehensive eye screening models, strengthening the strategy of eye health for all, infants to the seniors. NPCB also proposed 3-tier service setup of establishing 20,000 vision centers, 2,000 service centers, 200 training centers and 20 centers for excellence, the regional institutes of ophthalmology. The period between 1993 and 2002 was glorious years of performance of NPCB, and the success was attributed to conversion of cataract into IOL surgeries by 77% from 3% in 1993. In addition to training of surgeons and establishing infrastructures, over 95% of surgeries were IOL surgeries. Establishment of regional institutes of ophthalmology was a remarkable milestone of NPCB. The infrastructural supports and the granting aids to the eye banks needs a special appreciation. 2015 to 2019 NPCB National Surveys of people aged over 50 years is the latest iteration in NPCB's achievements. Unfortunately, illiterates and rural public suffer the most, which is still a great concern. Interesting that 60% of NPCB surgeries were performed in NGO and private hospitals, showcasing a successful public-private partnership program. Cataract surgical rates in India is amongst the highest of the developing nations, with over 6,000 surgeries per million population and very near to that of the United Kingdom. The prevalence of blindness and visual impairments have neared to the targeted goals in India only due to the successful program of NPCB. Several thousand ophthalmologists in India and from the overseas attain their surgical education as a continuing success story of NPCB every year. NPCB in India not alone is still helping to achieve high levels of ophthalmic goals, but also help in teaching and training of ophthalmologists within and outside the country, setting an example of a successful national program.